Diabetes Foot Care Introduction. The key objective of this presentation is to give you an insight to the magnitude of the diabetic foot problem in the world and to give an overview of this module. Diabetes is considered as a public health tsunami. It is becoming more common in Southeast Asian and African countries. Incidence of diabetes in Sri Lanka is 12%. This number is expected to be doubled in 2045. 10 to 20% of patients with diabetes will develop foot ulcers during their lifetime. Why feet are important in diabetes? Diabetes is the leading cause of non-traumatic amputation. Approximately, amputation happens once in every 20 seconds in the world. Unfortunately, we do not have local data to assess the gravity of this problem. Nearly half of the patients who underwent a major amputation due to diabetes dies within a year. Mortality rate of the patients after major amputations are worse than some of the known malignancies, and it is only second to lung and pancreatic biliary cancers. The earning capacity of the individual can be lost either temporarily or permanently due to diabetic foot problems and amputations. Since these wounds are chronic and take a long time to heal, cost of the wound care can be enormous. Patients may have to admit to the hospital time to time for wound debridement and antibiotics. They also need specially made orthotic offloading footwear to facilitate healing. Therefore, significant proportion of budget allocated for healthcare will be spent on treating diabetic foot problems. So, by preventing diabetic foot ulcers, not only can you save lives and limbs, but you can also save a lot of money spent on treating ulcers. 80% of amputations due to diabetes can be prevented. Amputation does not happen overnight. The stairway to an amputation depicts the most common compounding steps leading to limb loss in those with diabetes. These steps are development of peripheral neuropathy, deformity of the feet, callus and ulceration, development of peripheral vascular disease, sepsis, and amputation. The above process does not happen overnight. It takes at least 10 to 15 years for a patient with diabetes to develop foot ulcers. Therefore, as a healthcare professional, there is enough time for us to introduce foot ulcer preventive strategies to our patients. This is called primary prevention of diabetic foot ulcers. It is also important to remember that 60% of diabetic foot ulcers recur unless necessary steps are taken to maintain foot ulcer in remission. This is called secondary prevention. To achieve successful and sustainable results in the above prevention and therapeutic strategies, it is vital to establish integrated multidisciplinary approach. As a medical officer, you have to collaborate with other medical officers, specialists, nurses, orthotists, and patients and their relatives. This training module comprises of 6 components: Introduction to diabetic foot, foot assessment, risk stratification, diabetic foot education, diabetic footwear, and diabetic foot care procedures. Summary: Diabetes is the leading cause of non-traumatic amputation and has major implications on patients' lifestyle, survival, and finances. Foot ulcer does not happen overnight, and once developed, they tend to recur. Development of ulceration and amputation due to diabetes is preventable through structured multidisciplinary preventive programs. Thank you.